Understanding and preventing blood clots naturally. Blood clots can form when blood thickens and clumps together, creating a blockage that can interfere with normal blood flow. While some blood clotting is necessary for wound healing, abnormal clotting can lead to dangerous health conditions, such as deep vein thrombosis, DVT, pulmonary embolism, PE, or stroke. Here's a deeper look into what causes blood clots and how to prevent them naturally. Injury to blood vessels. When a blood vessel is injured, the body triggers a clotting response to seal the wound and prevent excessive bleeding. However, sometimes clots can form in healthy blood vessels due to other factors, increasing the risk of complications. 2. Poor circulation or immobility. Prolonged periods of immobility, such as long flights, bed rest after surgery, or sitting for long periods, can slow blood flow, increasing the risk of clot formation. Blood tends to pool in the legs, making clots more likely to form in veins. 3. Heart conditions. Certain heart conditions like atrial fibrillation, AFib, heart failure, or heart valve problems can increase the risk of blood clots. AFib, in particular, can cause blood to pool in the heart, increasing the chances of clot formation that can travel to the brain, causing a stroke. 4. Hormonal changes. Hormonal fluctuations, especially during pregnancy, taking birth control pills, or hormone replacement therapy, HRT, can increase the risk of clotting. Estrogen can make the blood more likely to clot, which is why women on these treatments may be more susceptible. 5. Genetic factors. Some people inherit conditions that make them more prone to blood clots. These conditions, called thrombophilia, can cause blood to clot more easily than normal. Genetic mutations like factor V Leiden or prothrombin gene mutation can be inherited and raise clotting risk. 6. Obesity. Being overweight or obese can put extra pressure on the veins, especially in the legs, and reduce blood flow, making blood clots more likely. Obesity is also linked to inflammation and other factors that contribute to clot formation. 7. Smoking. Smoking damages the blood vessels, increases clotting factors in the blood, and decreases oxygen levels, which raises the risk of clot formation. It also contributes to other cardiovascular conditions that make clots more likely. 8. Chronic conditions. Conditions like diabetes, high blood pressure, high cholesterol, and autoimmune disorders, e.g., lupus, can increase the likelihood of clot formation due to factors like inflammation, altered blood flow, or damage to blood vessels. 1. Stay active. Regular exercise promotes healthy circulation and reduces the risk of clot formation. Activities like walking, swimming, and cycling keep the blood moving and prevent stagnation in the veins. For those who have sedentary jobs, take short breaks to stand up, stretch, or walk around every 30 minutes to keep blood flowing. 2. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help prevent clot formation. Foods that are rich in omega-3 fatty acids, such as salmon, flax seeds, and walnuts, can help reduce blood clotting. Garlic, turmeric, and ginger are also natural blood thinners that may promote better circulation. 3. Stay hydrated. Proper hydration is essential for healthy blood flow. Dehydration can cause the blood to become thicker, increasing the likelihood of clot formation. Aim to drink enough water throughout the day to keep blood viscosity at normal levels. 4. Maintain a healthy weight. Maintaining a healthy weight can reduce the strain on your veins and improve circulation. It also lowers the risk of conditions like high blood pressure and diabetes, both of which can contribute to clotting issues. 5. Elevate your legs. Elevating your legs above heart level, especially if you're prone to swelling or prolonged periods of sitting, can help promote better circulation and reduce the risk of clots. Simple leg exercises, such as ankle rotations and leg lifts, can also help keep blood flowing in your lower limbs. 6. Wear compression stockings. Compression stockings can help improve circulation in the legs and reduce the risk of clots, especially for people who are prone to deep vein thrombosis or have jobs that require long periods of sitting or standing. 7. Avoid smoking and limit alcohol. Quitting smoking is one of the best things you can do for your cardiovascular health. Smoking not only increases clotting but also damages blood vessels. Limiting alcohol intake is important as excessive alcohol can increase clotting factors and contribute to dehydration. 8. Control chronic conditions. Managing chronic health conditions such as diabetes, high blood pressure, and high cholesterol is crucial in preventing blood clots. Working closely with a healthcare provider to keep these conditions under control can significantly reduce the risk of clotting. 9. Take natural blood thinners. Certain herbs and supplements, such as garlic, turmeric, ginger, cayenne pepper, and vitamin E, are believed to have natural blood thinning properties. However, always consult with a healthcare professional before using these, especially if you're taking blood thinning medications or have a bleeding disorder. 10. Monitor hormonal treatments. If you're on birth control or hormone replacement therapy, HRT, discuss alternatives with your doctor if you're concerned about your clotting risk. Some options, like progestin-only birth control, may have a lower risk of clot formation. If you experience symptoms of a blood clot, such as swelling, redness, pain, or warmth in the leg, chest pain, shortness of breath, or sudden numbness, seek medical attention immediately. Blood clots can be life-threatening if they travel to vital organs, such as the lungs or brain, leading to pulmonary embolism or stroke. Blood clots can be serious, but many lifestyle changes and natural remedies can help reduce the risk. Staying active, maintaining a healthy diet, managing chronic conditions, and avoiding smoking are all key components of blood clot prevention. If you're at high risk or have a history of blood clots, it's important to work closely with your healthcare provider to manage and monitor your health. Tell us what you think in the comments section. If you enjoyed this video, give it a thumbs up. Subscribe for more health tips.